This tip can help you avoid a serious kidney problem. In this video, I'm going to tell you the main signs and symptoms of weak kidneys, kidney failure, and I'll also tell you the causes, the function of the kidneys, and also how to prevent this disease. Did you know there are tips that can often help you avoid kidney problems? According to studies, 70, sometimes 75% of kidney diseases could be prevented. If you learn this tip that I'm going to give you at the end of this video, you have a very high chance of avoiding a kidney problem. Out of every 7 people, 1 has a kidney problem called weak kidneys or kidney failure to some degree. Look, it's extremely common, and many of these people don't even true it. There's an even more alarming fact. Out of every 3 people with advanced kidney weakness, 1 doesn't know it. So here, I'm not even talking about those early signs. Not just mild symptoms, but actually a more advanced disease. See how important it is for you to know about this? To know the signs, symptoms, and also how to prevent it in the best case scenario. In the United States, it's estimated that 35 million people have kidney problems, some degree of kidney failure. Look at that, 35 million. That's about 14% of the population. It's an extremely common and serious disease. So let's start with the signs and symptoms. I have picked out 9 here. But to understand the signs and symptoms, you need to know what the kidneys do. What are they for? Filtering toxins is one of the kidney's main functions, as well as controlling the amount of fluid in our bodies, the amount of water, and also electrolytes like sodium, potassium, magnesium, phosphorus. The kidneys are able to regulate all of that. If you have a kidney problem, for example, your potassium levels can rise in your blood and cause a number of complications, like arrhythmias, for instance. So this is very serious. Another function of the kidneys is the production of a hormone called erythropoietin, which stimulates the production of red blood cells. The kidneys are also involved in the activation of vitamin D. Vitamin D is essential for our bones. It's increasingly being studied for its importance to our health. If you have a kidney problem, you might have trouble activating this vitamin, which can also lead to serious consequences. So, in addition to filtering toxins, the kidneys have several functions that are essential for our lives. But how do you know if you have kidney problems? What are the signs and symptoms? But the first sign of kidney disease I'm going to discuss with you here. It's swelling. Swollen legs and feet. Usually, that's the first part of the body you end up noticing. Why? The kidneys have the function of controlling the fluid in our body. If you have any problem with filtration, swelling or fluid retention can occur. This fluid buildup tends to be worse at the end of the day because of gravity. The fluids tend to accumulate, and if you already have kidney problems, this can get worse. So, swelling. Whenever there is swelling in the feet or ankles, you need to check how your kidneys are functioning. There are also other places where swelling can occur, like in the lungs, for example, causing what's called pulmonary edema, or water in the lungs. Swelling can also happen in the belly, what's called water belly in medical terms. We call this ascites. But here, I'm going to highlight the legs and feet. The second sign that your kidneys are weak is waking up at night to urinate. Why is that? Since you have a buildup of fluids, often when you lie down horizontally, these fluids can return more easily, which can lead to you needing to go to the bathroom more frequently at night. But I'm also going to point out the other extreme. In some situations where the kidneys become weak, fluid can build up, and the kidneys don't eliminate fluids properly. So you end up urinating less frequently. So whether it's more or less, any problems with urination or urine volume mean you need to check your kidney function. The third sign, and this one you ask about a lot in the comments, is a change in the taste in your mouth. It could be bitter or have a metallic taste. This could indicate a problem with weak kidneys. Why? Because the kidney's job is to filter toxins and also urea. So when the kidneys are weak, urea can build up, and that can have certain consequences. So there are several reasons for this change in the taste in your mouth. Sign number 4 is fatigue. It feels like you wake up already tired. You feel unmotivated. There's the lack of energy. You can't do things the way you used to for two reasons. Here, I want to highlight that kidney problems can cause anemia. Did you know that one of the kidney's functions is actually to produce erythropoietin, which stimulates the production of red blood cells? So, if you have a kidney problem, you might have a decrease in this hormone, which causes anemia. And there's a specific characteristic of this type of anemia. It's called anemia that doesn't change the size or color of the red blood cells. It's different from iron deficiency anemia, where the red blood cells become small, or from vitamin B12 deficiency anemia, where the cells become large. Here, with kidney disease, the cells remain normal, but when we look at hemoglobin and hematocrit, we see a decrease. This can also cause or explain tiredness, paleness, changes in hair and nails, making them weak, but also because of the buildup of toxins, which will leave you feeling more sluggish. So when anemia is present, you need to check how the kidneys are doing, or look for these signs and symptoms. Sign number 5, which is also very important, is nausea and vomiting because of the buildup of toxins. Usually, the sign of nausea and vomiting, the person feels more queasy, has changes in appetite. This tends to happen in a moderate to advanced stage, okay? Because the kidney has already lost a good part of its ability to filter toxins, but it's one of the signs. And sign number 6 is high blood pressure, because the kidneys have the function of controlling the amount of fluids. If this is out of balance, there's a problem. When the kidneys aren't working properly, this can show up as increased blood pressure. And it's very important whenever diagnosing high blood pressure to check how the kidneys are doing, because that could be the cause. If that's the cause, it's unlikely to improve with medication or other changes because the problem is in the kidneys. So that should be addressed first and always needs to be evaluated. How's your blood pressure? I always advise my patients, and also here on the channel, to check their blood pressure at home, okay? Measurements taken at the doctor's office are very prone to variations. Some people have what's called white coat hypertension. Have you ever heard of that? That's when a person only has high blood pressure when they go to the doctor's office. But the opposite also exists, which is called masked hypertension. That's when someone has high blood pressure, but it appears normal at the doctor's office. The person feels more relaxed. This happens too. So you need to check your blood pressure outside the doctor's office as well, at least once a month. If you have blood pressure problems, then you'll need to check it more often, right? I always suggest 2 or 3 times a week, and it's important to always write down the results. The first and second numbers, your heart rate, and the date. What time was it? What were the circumstances? It's important to mention these things because it helps the doctor and can be a big clue for several diagnoses. Sign number 7 is foam in the urine. Did you know that foamy urine can be caused by a kidney problem? What problem is that? Usually this happens when the kidneys start losing protein. It means they're damaged. And when you lose protein, your urine will get foamy. You'll have foamy urine. A lot of times there's no change in color. People think there has to be a change in color, but that's not the case. The change will be this. There will be more foam. Sign number 8 is dry skin and itching. This can happen when urea starts to increase. In your blood and your body, it can cause this symptom. And sign number 9 is shortness of breath. Is shortness of breath breathlessness? Shortness of breath, difficulty breathing can be caused by anemia, but also by fluid buildup. The heart has to work with a larger volume of fluids, and water can also accumulate in the lungs, which makes it even harder. So there are several reasons here for shortness of breath. Shortness of breath should always prompt an investigation of kidney function as well. Now, what are the causes, tests, and how can you prevent kidney disease? What are the tips to avoid kidney disease? Let's start with the tests. There are 2 here that I want to highlight as fundamental. The first is the creatinine test. It's a blood test that through it we can estimate what percentage your kidneys are functioning at. They're filtering the blood. If this test result goes up, it means creatinine is building up in the blood and could indicate a kidney problem. So, creatinine is essential when evaluating weak kidney diseases. And what would be the normal value for this test? Usually up to 1.2 milligrams per deciliter. In some cases, for example, men who work out, do weight training, and have more muscle mass, this value can go up to 1.4 milligrams per deciliter. In other cases, like with elderly people, this reference value can drop to 1.0. So it can vary. There's a small variation there. But as a rule, anything above 1.2 is a warning sign for kidney disease. Another test that's also fundamental in evaluating the kidneys is the urine test, called a urinalysis or simple urine test. It's the qualitative urine test. So what is this test like? It's the test where you go to the lab and pee into a little cup. And an analysis is done on the urine to see if there's glucose, if there's sugar in it, if there are proteins before you even get that sign, which is foamy urine, or if there's blood. It will also show the urine's density and provide other data, which allows the doctor to determine if you have a more serious kidney problem. So these two tests are fundamental. There are others as well, like the 24-hour urine test, but that one is only done if the doctor suspects something, okay? It's not a routine screening or checkup test, unlike the ones I mentioned here. These two are fundamental. What are the main causes? The two biggest ones by far are diabetes, because high blood sugar can damage the kidneys. And the second major cause is high blood pressure. When the body operates with higher blood pressure, it can damage the kidneys, causing changes in how the kidneys filter. These are the two main ones. Other causes, like recurring kidney stones, can also lead to weak kidneys. The use of medications, this one is becoming more and more common, especially anti-inflammatory drugs like nimesulide, ketoprofen, ibuprofen, diclofenac, naproxen. These anti-inflammatories can alter kidney filtration. And also, if there isn't medical supervision and there's abuse of these medications, it can lead to weak kidneys. Look, this is really interesting. So only use medication if you have a doctor's recommendation. Sometimes you take an anti-inflammatory thinking there's no problem, and you could end up with kidney failure, weak kidneys. Other causes, like multiple cysts in the kidneys, called polycystic kidney disease, a genetic condition, can also lead to weakened kidneys. Repeated kidney infections can also cause scarring, which can compromise their function. Autoimmune diseases like lupus can inflame the kidneys. So there are several causes, but I'm going to focus here on the two main ones. The most common by far are diabetes and high blood pressure. And how can you prevent it? You know what I said? That some tips could cause a sharp drop in kidney diseases. There was an American study that found that 70 to even 80% of the causes of weak kidneys could be prevented. Look, isn't that interesting? Well, the first tip is to control your blood pressure levels. You saw that high blood pressure can damage the kidneys. So you have to control your blood pressure. It's one of the main causes. In some countries around the world, this is the most common cause. The second way to control it is by managing your blood sugar levels. How are your blood sugar levels? Do you have diabetes? Is it under control or not? High levels can also damage the kidneys, compromising filtration. This is the biggest cause. In most places in the world, diabetes is already the main cause. In others, it's still high blood pressure. Often they keep alternating between the most common disease that causes kidney problems. So control your blood pressure, control your blood sugar levels. This is fundamental. The third tip is about physical activity, which can protect your body from various diseases. And one of those diseases is kidney failure. So at least 150 minutes of physical activity per week. This should be split into 3 or more sessions. It can be at the gym, it can be weight training, it can be swimming, it can be walking, it can be running. Do the exercise you have access to, the one you can stick with in the long run. This will benefit your heart and your kidneys as well. Number 4 is about diet. Consuming sodium and salt can increase the chance of kidney problems as well. Did you know there's an amount that's actually beneficial for your body? What is the recommendation? According to the WHO, the World Health Organization, it's 2 grams of sodium per day or 5 grams of salt per day. The average consumption in the United States and Europe exceeds 10 grams of salt. Look at that! This over time can lead to changes in your body, like increased blood pressure. So every now and then, if you consume a little more sodium or salt in a day, it won't cause problems. But for those who have the habit of consuming it, and as you saw, there are many people who do, then yes, it can cause serious chronic issues with the kidneys, okay? Also, avoid foods with added sugar, because sugar also affects the kidneys. How does that work? It can increase insulin. For example, if you are diabetic and have an issue with insulin, insulin also plays a role in the kidneys. It acts by retaining sodium. So by reabsorbing sodium, it can also cause complications and lead to increased blood pressure. This action of insulin is not very well known. It's a more recent discovery. So that's one more reason for you not to consume sugar. And also avoid ultra-processed foods and processed meats. That means frozen pizza, frozen hamburgers, those ready-made lasagnas you buy at the store, salami, sausage, all those processed meats. Instant noodles, that's instant ramen. Did you know that a single serving of instant noodles has about 70% of the sodium you need in a whole day? So chances are you're gonna go overboard. So you really need to pay attention to your diet. Number 5 is about avoiding the use of medications without a doctor's prescription. Did you notice I talked about anti-inflammatories? All the ones I mentioned can cause kidney failure, but there are plenty of others too. So this habit of taking medicine on your own can be really dangerous. And by doing this, now that you know which medications to avoid without a doctor's prescription, you can also prevent kidney disease. And the 6th way to prevent kidney disease is by controlling your weight. Why is that? When you have a higher body weight, your body has to handle a larger volume of fluid, which means greater blood volume. And that can put extra strain on your kidneys. So weight control is essential for prevention. And even for the treatment of kidney disease. Just like kidney disease, there are also signs and symptoms that can indicate cancer. Would you know how to recognize the signs and symptoms? A lot of people ignore them. I suggest you learn about this. This could also save your life. It can lead to an early diagnosis. You have a much higher chance of being cured. If you click here, you'll be taken to a video where I talk about it. About the signs and symptoms of cancer. Take care.